Every week, millions of American seniors make what they believe is one of the healthiest decisions of their day. They drop a handful of leaves into a blender, they pile it into a salad bowl, they stir it into a smoothie alongside fruit and protein powder. They are doing exactly what their doctor told them to do. They are eating their greens, and specifically, they are eating spinach, the superfood, the iron rich, nutrient dense, Popeye approved vegetable that has been marketed to the American public as the gold standard of healthy eating for decades. What I am about to tell you has been documented in peer reviewed nephrology journals. It has been confirmed in clinical case reports at major American hospitals. And it is information that the doctors handing out the generic advice to eat more leafy greens are almost never sharing with their patients over 60. For a significant portion of seniors, spinach is not a health food. It is a slow, invisible assault on the organs your life depends on. My name is Dr. James Mercer. I am a board certified physician with 35 years of clinical practice and over 40,000 patients treated. I want you to understand before we go any further that this video is not about demonizing vegetables. It is not about telling you that plants are dangerous. It is about telling you the truth that the blanket advice to eat more spinach does not account for the specific biological vulnerabilities that develop in the human body after 60. And the truth is that those vulnerabilities change everything. Let me start by explaining what is actually in spinach that makes it a problem. And the answer begins with a compound that most people over 60 have never heard mentioned in a doctor's office: oxalic acid, or in its salt form, oxalate. Spinach is one of the single highest dietary sources of oxalate on the planet. A half cup of cooked spinach contains approximately 755 milligrams of oxalate. Raw spinach in a salad or a smoothie contains a similar load. To put that number in context, most clinical nephrologists, kidney doctors, recommend that patients with any degree of kidney vulnerability consume no more than 100 to 200 milligrams of oxalate per day in total from all food sources combined. A single serving of cooked spinach delivers 3 to 7 times that threshold in one sitting. Now, here's the question every person watching this needs to ask themselves: what does oxalate actually do inside the body? Oxalate is an end product of metabolism. Your liver produces some of it naturally, and the rest comes from the food you eat. The body has no enzyme capable of breaking oxalate down. It cannot be metabolized. It cannot be neutralized by digestion. It has one route out of the body, and that route is through your kidneys. Your kidneys filter oxalate from the blood and excrete it in the urine. In a young, healthy person with fully functioning kidneys and an adequate intake of calcium and fluid, this process generally works without incident. The oxalate binds to calcium in the gut, passes through the digestive system without being fully absorbed, and exits the body. But here is where the story changes for a person over 60. And this is the piece of information that should be in every clinical conversation about diet and vegetable intake in the senior population, and almost never is. Kidney function declines with age. This is not a catastrophic statement. It is a documented biological reality. Adults over 60 have, on average, 20 to 30% lower kidney filtration capacity than they had at 40. Data from the National Health and Nutrition Examination surveys estimate that approximately 40% of adults above age 60 already meet the clinical definition of some degree of chronic kidney disease, whether they know it or not. Among adults over 70, the prevalence of kidney disease is even higher. Over 50% of adults over 80 show measurable kidney function impairment using current diagnostic equations. Let me be specific about what this means. As kidney filtration capacity declines, the kidney's ability to efficiently clear oxalate from the bloodstream diminishes proportionally. The oxalate that should be efficiently filtered out begins to accumulate. And when oxalate concentration in the blood and urine becomes elevated, Something begins to happen inside the kidney that is completely invisible from the outside and absolutely catastrophic from the inside. Calcium oxalate crystals form. These are microscopic, sharp crystals that deposit directly inside the tubules of the kidney, the tiny tubes through which filtered fluid passes on its way to becoming urine. Those crystals do not dissolve. They do not pass through gently. They embed in the tubular tissue. They trigger an acute inflammatory response. They obstruct the tubular architecture, and over time, with repeated daily exposure to high oxalate loads from the food sources everyone told you were healthy, those crystals accumulate into a condition that nephrologists call oxalate nephropathy. And oxalate nephropathy can progress silently and without obvious symptoms to irreversible kidney damage. I'm not speaking in theoretical terms here. I am going to tell you about a case published in a peer-reviewed nephrology journal because it represents exactly what I have been describing, and I want it to be real to you. A 68-year-old man, diabetic for 18 years, somewhat elevated blood pressure, not perfect health, but functioning. His kidney numbers were acceptable. Then, wanting to take better care of himself, he began a daily spinach and vegetable juicing regimen, a blended drink of raw spinach, Swiss chard, and other greens every single day. He believed he was doing the right thing. He had been told to eat his greens. For 6 months, he drank this every morning. At the end of those 6 months, he presented to the emergency department with weakness and acute kidney injury. A renal biopsy was performed. The results showed extensive calcium oxalate crystal deposits throughout the kidney tubules, acute tubular damage, end-stage renal disease. That man has been on dialysis ever since. That is not a rare edge case in the published literature. A 2024 case report published in the journal Cureus documented a 54-year-old diabetic man with early chronic kidney disease who was regularly consuming spinach and kale smoothies, believing they were beneficial for his diabetes. His kidneys deteriorated into acute kidney injury. Renal biopsy confirmed calcium oxalate deposits throughout the tubular tissue. He did not recover kidney function. He remains on hemodialysis. A 2024 literature review published in the journal Integrative Medicine examining the role of dietary oxalate in chronic inflammatory kidney disease in middle-aged and older individuals identified excessive consumption of high oxalate leafy greens as a direct contributor to chronic kidney inflammation and progressive renal damage. The authors specifically noted that oxalate from food sources can contribute significantly to chronic kidney disease progression in vulnerable populations. Now, I want to be precise about something because I know the question forming in your mind right now. Does this mean all spinach is dangerous for everyone? No, that is not what the science says. And I am not going to tell you that either. What the science says is this: for a younger person with fully functioning kidneys, no diabetes, no hypertension, no history of kidney stones, and no existing kidney vulnerability, moderate spinach consumption is unlikely to create the acute crisis I just described for a person over 60 with any of the following risk factors. The calculation changes entirely. Do you have diabetes or prediabetes? Then your kidneys are already under oxalate excretion stress. Do you have high blood pressure? Chronic hypertension accelerates the age-related decline in kidney filtration capacity. Have you ever had a kidney stone? If that stone was a calcium oxalate stone, which is the case for approximately 80% of all kidney stones, your oxalate metabolism is already dysregulated. Do you have any diagnosed kidney disease, even mild, even early stage? Do you take regular NSAIDs, ibuprofen, naproxen, aspirin in high doses? These medications reduce kidney blood flow and impair the kidney's ability to clear oxalate efficiently. Are you regularly drinking green smoothies, adding spinach to multiple meals daily, or following a juicing regimen? If you answered yes to any combination of these, you are in a category where the blanket advice to eat more spinach is not just unhelpful, it is actively dangerous. And in my 35 years of practice, I have sat across from patients who fit this description, patients who were dutifully following the dietary advice their doctors had given them, who had no idea that the vegetable filling their salad bowl every day was contributing to the quiet destruction of their filtration organs. This is information seniors deserve to have, and the reason they so rarely have it is not malice. It is the structural limitation of a medical system that gives general public health advice without accounting for the specific physiological changes of aging. Eat your greens is good advice for a 35-year-old. It requires significant qualification for a 68-year-old with diabetes, hypertension, and kidneys that are already filtering at 65% of their former capacity. Let me now walk you through the second mechanism by which spinach creates problems in the senior body that doctors rarely discuss. And this one concerns not the kidneys, but the cardiovascular system and something called hyperoxaluria. When oxalate is not efficiently cleared by the kidneys, blood oxalate levels rise. Elevated blood oxalate does not stay only in the kidneys. Oxalate crystals can deposit in the walls of blood vessels, in the heart muscle itself, in joint tissue, in the thyroid gland, a condition called systemic oxalosis, where oxalate crystals deposit throughout the body, is the extreme end of this process. But lower grade chronic hyperoxaluria, chronically elevated oxalate levels in the blood and urine, is associated with vascular inflammation, arterial stiffening, and cardiovascular risk elevation. In the aging body, where arterial walls are already more vulnerable to inflammatory insult than they were at 40, this is not a minor consideration. And there is a third mechanism I need to explain. Spinach is loaded with a compound called vitamin K, specifically vitamin K1, which is the plant-based form. In most people, vitamin K1 plays an important role in blood clotting and bone metabolism. But for a person over 60 who is taking warfarin or any other blood-thinning medication, a common prescription for atrial fibrillation, deep vein thrombosis, or stroke prevention, spinach is a direct pharmacological antagonist to their medication. Vitamin K and warfarin work in direct opposition. Warfarin works by blocking vitamin K-dependent clotting factors. Every time a patient on warfarin eats a large serving of spinach, they are partially reversing the effect of their blood thinner. The INR, the blood test that measures how well warfarin is working, becomes unpredictable. And an unpredictable INR in someone taking a blood thinner is genuinely dangerous. It increases the risk of both dangerous clotting and dangerous bleeding simultaneously. This is information your cardiologist should be telling you. This is information your primary care physician should be raising the moment they write that warfarin prescription. Most of them do not have time. Now, let me give you the practical guidance that turns all of this from alarm into action. Step one, right now, today, take an honest inventory of how much spinach you are consuming weekly. Is it in your daily smoothie, multiple salads, cooked into multiple evening meals? If you are eating spinach every single day in significant quantities, and you are over 60 with any of the risk factors I described, you need to speak to your physician about getting your creatinine and BUN levels checked. These are simple blood tests that give a picture of how your kidneys are currently functioning. Request a basic metabolic panel. Ask your doctor to calculate your estimated GFR, glomerular filtration rate, which is the standard measure of kidney filtering capacity. This number will tell you exactly what category of risk you are in. Step two, understand the difference between spinach and the leafy greens that are genuinely safe for the senior body in quantity. Here is the revelation that most people do not know. Not all leafy greens are created equal in their oxalate content, and several of them are dramatically lower in oxalate while offering comparable or superior nutritional benefit. Kale. The National Kidney Foundation specifically lists kale as a low potassium, lower oxalate green that is far preferable to spinach for kidney vulnerable individuals. Kale still provides vitamins A, C, E, and K, along with sulforaphane, the anti-cancer and anti-inflammatory compound I have discussed in previous videos. It does not carry the oxalate burden that makes spinach dangerous in large quantities for seniors. Arugula. Significantly lower oxalate than spinach, rich in nitrates that the body converts to nitric oxide for cardiovascular benefit. Excellent for blood pressure and arterial flexibility. romaine lettuce and green leaf lettuce. Both are extremely low in oxalate and can be eaten freely in large quantities. Use these as the foundation of your salads rather than baby spinach. Bok choy, another green with very low oxalate content, rich in calcium, vitamin C, and anti-inflammatory compounds. Cook it in olive oil with garlic, and it is one of the most satisfying and protective vegetable choices available to a senior. Cabbage. Red cabbage in particular is extraordinarily low in oxalate and packed with anthocyanins, the purple pigment compounds associated with reduced cardiovascular disease risk and cognitive protection. Broccoli. This is the one I push hardest in my practice. Yes, broccoli is a green. Yes, broccoli contains sulforaphane. And yes, broccoli is in the lower oxalate category compared to spinach. Eat this daily. Steam it. Roast it in olive oil. Add it to eggs. It is doing something for your body that spinach simply cannot do without also creating risk. Step 3. If you are drinking green smoothies, this step is critical. Stop using raw spinach as your smoothie base immediately and replace it with kale, arugula, or frozen broccoli. Raw spinach contains the highest oxalate load of any smoothie ingredient in common use. And the act of blending it, which breaks down the cell walls and concentrates the juice, actually increases oxalate bioavailability compared to eating whole spinach leaves. The smoothie that your wellness influencer assured you was the healthiest way to start the day may be delivering a concentrated oxalate dose that your aging kidneys were never designed to handle. Step 4. If you continue to eat spinach at all, and some of you will, and that is your choice to make with full information, there are 2 things that reduce its harm profile meaningfully. First, cook it. Boiling spinach and discarding the cooking water leaches a portion of the oxalate out of the leaf and into the water you discard. This reduces the oxalate load compared to raw spinach, though it does not eliminate it. Second, eat spinach only alongside a calcium-rich food. Calcium and oxalate bind together in the digestive tract before the oxalate can be absorbed into the bloodstream. When they bind in the gut, they form an insoluble compound that passes through the body without being absorbed. A small amount of yogurt, a piece of cheese, or a glass of milk eaten at the same meal as spinach significantly reduces the amount of free oxalate that enters the bloodstream. This is the mechanism that makes the nutritional advice to consume calcium-rich foods with oxalate-containing vegetables clinically meaningful. Step 5, hydration. This one is simple but not optional. Adequate fluid intake is the kidney's primary defense against oxalate crystallization. When urine is dilute, when you are drinking enough water, the concentration of oxalate in the urine remains too low for crystals to form efficiently. When urine is concentrated, as it often is in seniors who do not drink enough because the thirst sensation diminishes with age, oxalate concentration rises and crystal formation risk increases. If you are in a high oxalate dietary period or you have any kidney stone history, the single most effective protective measure is drinking at least 2 to 2.5 liters of water per day, every day, without exception. Now, let me tell you something that I have wanted to say publicly for a long time. The wellness industry in America operates with almost no accountability for the nutritional advice it delivers to older adults. Green smoothies, superfood blends, juicing protocols. These are marketed with the assumption that more plants equals better health. And that assumption is true enough for a healthy 35-year-old that nobody questions it. But it is profoundly incomplete when applied to a 68-year-old with reduced kidney function, a history of kidney stones, diabetes, and 5 daily medications. The advice that is correct for one population can be dangerous for another, and seniors are the population most likely to follow health advice dutifully and least likely to be told that the advice was not designed for their specific biology. In 35 years of practice, I have watched the green smoothie trend accelerate. I have watched patients come in carrying the specific medical complications described in the nephrology journals, and I have watched the gap between what patients were told to eat and what their aging bodies could safely process grow wider and wider. Today, I am doing my part to close that gap. Now, let me walk you through 3 futures, because how you respond to this information in the next 24 hours matters enormously. In the first future, you hear what I said today and decide it probably does not apply to you personally. You feel fine. Your last doctor's appointment went fine. You keep the daily spinach smoothie, the spinach salads, the spinach added to everything in the name of eating healthy. 6 months from now, your kidneys have continued processing the oxalate load with the reduced efficiency that 60-something-year-old kidneys provide. No acute crisis. But the crystallization process continues at a low level inside the tubular tissue. The cumulative damage accumulates invisibly. The window for early intervention, the window where simple dietary adjustment could change the trajectory, it keeps closing a little further each month. In the second future, you switch some of your spinach consumption to lower oxalate greens, but not all of it. You replace the smoothie spinach with kale, but keep the spinach salads. This is a meaningful improvement. The daily oxalate load decreases, the risk profile drops, but without knowing your current kidney function numbers, you are still operating without full information, half the benefit with half the protection. In the third future, you make 2 phone calls this week. The first is to your physician to request a basic metabolic panel and an EGFR calculation. You want to know exactly where your kidneys stand right now. The second call is to yourself, a quiet commitment to replace the daily spinach with the greens that deliver equivalent or superior nutritional benefit without the oxalate burden. Kale, arugula, romaine, bok choy, cabbage, broccoli. You drink your 2 to 2.5 liters of water every day. You stop putting raw spinach in your smoothies, and you give your kidneys, the organs that filter your entire blood supply 24 times every day, the informed dietary respect they have earned. That third future costs you nothing except information, and you now have the information. Here is my personal medical opinion, and I am going to say this plainly because I believe you deserve plain talk. The generic advice to eat more spinach was written without adequate consideration of what happens to oxalate metabolism in an aging kidney. It was written for a general adult population, not for a 67-year-old with stage 2 chronic kidney disease, a history of calcium oxalate kidney stones, and a daily green smoothie habit. The fact that peer-reviewed nephrology journals have documented cases of seniors entering dialysis after following what they believe to be healthy dietary advice is not a footnote. It is a crisis of nutritional communication, and it is one I refuse to stay silent about. Eat your greens, absolutely. Just make sure they are the right ones for the kidneys you have at your age, not the kidneys a 35-year-old has on a poster in a gym. I want to hear from you in the comments. Have you been eating spinach regularly thinking it was good for you? And has your doctor ever talked to you specifically about oxalates or kidney function in the context of your diet? Tell me below. I read every comment, and your answers guide exactly what I cover next. If this conversation gave you something real today, hit that subscribe button right now, because next week I am going to reveal the single most common blood pressure medication side effect that doctors routinely misdiagnose as normal aging in people over 65, and what you need to ask your doctor immediately if you are on one of these medications. You cannot afford to miss that one. I am Dr. James Mercer. Take care of those kidneys. They are quietly doing the most essential work in your body. I will see you next week.